Hi, I'm MC, and this is my podcast. I've learned a few things being an equine body worker for over 20 years, and this show is dedicated to helping the horses. Hi, horse loving folks. MC here. Today we're going to be speaking with Carla Odetto, owner of Performance Equine Nutrition, with the internationally recognized magnesium supplement for horses, Mag Restore. This is part 2 of a 2-part episode. I hope you were able to locate part 1. Here we are continuing our conversation with Carla. Enjoy.
If you're on a horse that's well trained and physically and mentally suited for the job, you shouldn't have to fatigue them into behaving. You shouldn't have to fatigue them before you go in the show pen and ask them to perform for you.
Right.
Nowhere in human athleticism or athletes do we go, well, you know what, I'm going to do a 5-mile warm-up before I run a marathon. We don't do that. But we do that to our horses all the time. And I think that it's because what else? We don't know any better. We don't know that a lot of times these horses can't relax and they can't settle and they can't have that calmness prior to competing because they're deficient. Right. And then they get to a show where it's more hectic, more chaotic. We lunge them more. Now we've created more of a deficit and now they're more symptomatic. And so then they get drugged.
And a lot is also, right. I mean, pain in general will deplete magnesium, and
absolutely. So it's anything that adrenalizes a horse will burn through magnesium much more rapidly. So some of our speed event horses, that just by the nature of what they do, they burn through magnesium at a much more rapid rate. Because, for instance, your barrel horses, they have to be adrenalized to do that. But in that process, they burn through enormous amounts of magnesium. And I think this is why we see so many of our barrel horses just with gait issues, rearing, all of that behavior, because their nervous system is just completely spun. Mm-hmm. When they get to a performance or to a race, they're adrenalized already. Now they're creating more of a draw for magnesium on their body, which makes them more symptomatic and harder to handle it. Every time they go, they get a little bit worse and a little bit worse. And these barrel horse girls, they can ride some stinkers. They can ride some pretty rank horses that get really awful in the alley. And I think that they've just raised their game as to what they can hang on to. Mm-hmm. And so many of my barrel horse customers just go, oh, this is so nice. She walks down the alley. She's flat-footed. Right. She's not popping up and popping up off the third barrel and getting hollow and high-headed. I could just go on and on about the things that we see once we get magnesium on board.
It just becomes so cyclic, and it's all about natural selection. We have to understand these animals' bodies. Let's just think of them in a herd of performance horses. Some of them have to break down and die. And these are the processes that are happening, and the central nervous system becomes very, very nervous and excited when the body starts to break down. And it's all about the natural selection process. And we start to see stallions overreacting, mares overreacting. Yes. And it's just a part of a mammal's body getting more vulnerable to life's pressures and
I think
pain.
This is why the market for commatives is enormous. And again, and I tell my customers this too, we have a commative called Focus Equine, and it works great. But I always start my customers off on Mag Restore, and 9 times out of 10, they don't need to go to a commative once we get magnesium status back up where it belongs. Mm-hmm. However, the industry is just so geared towards one scoop fixes all, and one dose should do it. And that's just not the case with this especially. Mm-hmm. But I think people will reach for a commative because they don't know what else to do. And so many times once we get magnesium levels up, like I said, those horses just come back to who they were prior to deficiency and who they were genetically predisposed to be. However, sometimes these horses have been deficient for so long and they've been treated heavy-handedly.
Right.
These horses really are, they're the ones that, like I said, buy themselves more time in the round pen. They get tied out. They get sacked out a million times. They get treated rough. And so even after we restore magnesium levels, if they've been deficient for a long time, they've developed behaviors, habitual behaviors, because they've been deficient. So they're afraid to go to work. they've been treated badly and heavy-handedly for years. And so these horses have what I call training baggage. These are the horses that do benefit from accommodative such as focus equine after we've addressed magnesium levels. But I tell my clients, no accommodative will work well or long-term unless and until you make sure you have enough magnesium going into their diet and you have good magnesium levels and you don't have magnesium deficiency symptoms. Otherwise, we're just slapping a Band-Aid on it again.
And we need to recognize that, well, you can if you want to, and if you don't want to, you don't have to.
Yeah.
That if a horse is behaving badly, they hurt. Behavior's language. Exactly. I actually went to work in a barn one day. Very nice man. He didn't mean to say what he said. This is just how callous we've become. And he opened up the stall door. Horse was laying down. He kind of looked at me like, oh, God, what now? And I go, oh, it's okay. It's okay. You're a good boy. It's okay. And the man looked at me and with a scowl said, actually, no, this horse is not a good boy. And I went, oh, no, you are not. And I just said, sir, I need to see him through. This is his day to get some help, not through what you're dealing with him. And I'm sure the trainer is, hey, I wouldn't want to deal with an unruly horse.
Right. Yeah.
Either way,
these horses challenge us as men, as good horsemen and women. I'll tell you, these magnesium deficient horses make you feel like you're losing your mind because
right.
As good horsemen and women, we are aware of good training techniques. We know what works. We've been doing this a long time. It's some of it's instinctive at this point. You don't even have to think about it. However, these magnesium deficient horses put their owners through the ringer. What works one day doesn't work the next. They're consistently inconsistent. There's no rhyme or reason to why they do what they do, the intensity with which they do it, their frequency. And you can have a great day where you think, oh, this saddle pod, this bridle, this everything, this was the answer. I had a good day today. And you can repeat everything exactly the same the next day, and your horse is completely different. And so these horses are incredibly frustrated for the people who own them because good training techniques just don't work or they don't stick. I'm
experiencing horses cannot stand still in the cross ties the way they used to. I'm like getting frustrated, getting mad, and I get mad. I just say, hey, there's something going on inside this animal. I don't have the right to get mad. I mean, I've literally had to walk animals back to their stall because I want to punch them instead of do body work on them. Give them a bell. And I literally one day I had to laugh. I'm like, we're going back to your stall. So if you want to get mad at a horse for not behaving, maybe give him a chance. Say, hey, is there something going on with you? And because these are very sophisticated trainers out here. We have men and women that have grown up in the saddle. They know what to do with horses, and they're frustrated as heck. And so there's a sign that something that we're not talking about is going on.
Exactly.
When you're a great trainer,
have a difficult life because, and many of them, they're well bred. They're very high end animals. And just the fact that the owner paid a giant pile of money for them puts undue pressure on that horse. Like, look, I paid good money for you. You better come to the party. You better get with it. And these horses oftentimes don't come to the party because they physically can't. Mentally and physically, they're not.
However, as a equine communicator and somebody that understands their level of understanding frequency, they can feel that when the pressure's on them. They know, and they are such loyal animals that I believe their souls are a little depressed right now, that they're like, hey, man, I can't give you what you want from me, and I don't know what to do about it.
Right.
And by the way, if you have
negative association to work being handled, anytime someone comes and picks them up out of their stall, they're like, oh God, what's going to go, this is going to go bad.
Oh, could you imagine? Can you imagine having that stall door open? You're not quite done with your food, on and on and on. And, I really, really want to say there's some goodies in this conversation for the public. And one of the goodies is if you have locked up muscles, toxic muscles, you're going to have a locked up cervical vertebrae column. If you have locked up C3, C4, you have locked up L3, L4, lumbar L3, L4. If you have locked up L3, L4, you have locked up hocks, bicep femoris, and stifle. So all of these knee, stifle challenges, and especially with Rainers, who needs to use their knees more than anything on this planet. So if you have tight muscles, the vertebrae column, and again, this is a little secret I'm going to tell you, and these are secrets of mine, where I'm able to get knees functioning better. We're working through the C3, C4 transition, cervical vertebrae, and the L3, L4, which holds the ischiatic nerve communication to the glutes. The glutes feed the bicep femoris, and the bicep femoris inserts onto the kneecap. So that's basically a pulley and cable system going from the neck to the knee. And if your muscles don't give and take enough, if they're inactive, see, I'm a muscle activator. I like to activate muscles. And so if you don't have enough of this nutrient, this wonderful mainframe nutrient, magnesium, you will, your whole system will lock up in your knee zone. And when their knees hurt, that's when the serious challenges come on for them neurologically. These animals are hardwired to live, to survive. And when these body parts, when these body parts become challenged or pain signals tell their brain they're not okay, then we start to get anxiousness, nervousness. Oh my God, I'm not going to be able to do this. I can't do this. And I mean, I'm saying that, I'm putting that label on it. But again, I'm going back to body language is behavior is language. And when we're looking at the language that's coming off of their bodies, they're challenged. They're in fear. And these are athletes, you know, there's no reason why they should have this.
Yeah, they're not tools. They're athletes. They're living beings. And I can tell you this too. This has been something that it's not published anywhere, but I know it because I talk to thousands of people. And I've been doing this for 15 years now. Rehab is one of the most interesting parts of this, in that you would think that rehab would not burn through excess magnesium because they're not working. But I have so many clients who contact me and say, look, I have this horse, had a soft tissue injury, whatever. It's had, rehab any length of time, a month, 6 months. But these horses go into rehab being pretty sensible, pretty on top of things, just normal, good citizen. And they don't come out of rehab the same. They come out of rehab anxious, worried, nervous. And rehabbing a horse depletes magnesium. I've seen it time and time and time again that these horses don't come out of rehab mentally the same way they went in. And it's because they get deficient in magnesium. Depending on what they're being rehabbed for, an infection, antibiotics deplete magnesium, EPM treatment depletes magnesium, omeprazole, which is one of the things that they just give out like candy, especially to a horse that's rehabbing. Well, we're rehabbing, you better throw it on omeprazole. Right. Omeprazole inhibits absorption of magnesium. And so these horses become very deficient, even in the stillness of rehab. That's something that I really want to get out there. These horses need that support. I think being isolated is stressful for them. Not being able to express themselves physically, being cooped up is super stressful for them, and they will become deficient.
Right. And this isn't a one or the other about the veterinarian, Western medicine, pharmaceutical medicine or not. We all know we've had a lot of exciting stuff developed the last 100 years with pharmacy medicine, but it's time for a rounding out. Anybody that is interested in these animals, it's time to round out. And I've had senior veterinarians, they know that. I mention this over and over, repeat myself, but my father was a doctor, and at the end of his life, he made the statement that medicines are making people sicker. So it's not a one or the other. It's looking at both worlds. And when you need, which one? You need to live on, manage. Your life needs to be managed on nutrition. If you have an infestation or a medical need, we need the pharmaceutical medicine. And I would like to see nutrients in every veterinarian office. I would like to see body work offered in every veterinarian office. That's my dream. That's my hope. And I think that's fair for these animals. If they're taking over total control over what's going on with them, let's empower that industry with more knowledge. And so
I've had so many clients, whose horses have really been on the bottom rung of deficiency, and then they've gotten soft tissue injuries, and they act silly. I've had customers who have had unnecessary kissing spine surgery. I've had customers who have had their mares spayed. I mean, the lengths that they've gone to try and manage this behavior that no one can seem to figure out what's going on.
Right.
Only to find out that it was magnesium shortfall this whole time. Some of my clients get pretty upset and pretty discouraged and pretty mad that the money that they've spent on hock injections and muscle relaxers and reserpine, you name it, only to just land in the same place when the drugs wear off or the drugs didn't help or nothing really lasts long term, only to find out it's been magnesium deficiency the whole time.
Right.
Lots of money has been wasted and horses have been put through a lot of undue stress and surgeries because the veterinary industry doesn't know what else to offer.
Well, yeah. I mean, we just have to understand what it is. They're offering a certain type of service, gold standard of care. When they come out of these institutions, a lot of these student loans are actually loans from dollars that come from the procedure and medicine world. So, that's just what it is. And so we just want to help the public round out their knowledge so we can actually keep that industry in business too. Because I know people over the last 10 years that have pulled their horses left and right. The showing industry has shrunk considerably. People can no longer afford to pay $20,000 for a horse that's living on $1,000 worth of medical care a month.
Yes.
And so this is, again, just trying to keep the warm fuzzies going. And, I would like to see functional veterinarians. We have it in the human world, functional medical doctors. And I think it's time that we start to adopt that also in the veterinarian world. The pharmaceutical industry is always going to have a lot of money, and we're always going to have animals that are going to need those approaches. So again, this is not a black and white, one or the other. This is way overkill on medically trying to deal with a mammal's depleted nutrition. And so,
the
Carla,
other thing I'd like to point out to you, and this is probably something that you see frequently in your practices, that when a horse doesn't have enough magnesium in their diet, we know that their range of motion decreases, their muscles stay hard, they're more prone to soft tissue injury. They're also more prone to bone spurs and calcification.
Absolutely.
Because old science, or it's kind of a myth, everybody thinks that you got to feed magnesium and calcium together. You don't. And the last thing we want to add to a horse's diet who is magnesium deficient is more calcium. That's a no. That's like horses don't become deficient in calcium. I mean, I've talked to numerous vets. It's just not a thing. But back to my point, we don't need to feed magnesium and calcium together. But you do need to, if you are supplementing with calcium, you do need to make sure that you've got adequate amounts of magnesium going in, because calcium needs magnesium to properly assimilate in the body. And excess calcium without enough magnesium calcifies in the form of stones, bone spurs, calcification. So again, we talked about this the other day, all the osphos and all this excess calcium that these horses are getting, especially in the racehorse world. All this excess calcium is working against them, actually. It doesn't increase their bone density. It makes their bones brittle and less flexible. Magnesium gives flexibility to things, muscle, bone, soft tissue. So,
something you said to me is, and I like the way you said it, is calcium contracts a muscle and magnesium opens a muscle.
Right.
So basically,
One of the things I do on the phone with all of my clients is I say, while you're sitting there, make a fist. That's calcium at work in your body. Now let your fist go. That's what magnesium does. And without enough magnesium, the muscles don't fully relax from a contraction. They stay hard. They stay stiff. So, and on it goes. And then it's a ripple effect in the body.
And then with the crystallization, basically, and again, I'm not pretending to be a scientist and saying this, but what ends up happening is when the calcium holds that rigidness, because we know bone grows to pressure, bone changes to pull and pressure because it's just trying to protect itself. So the insertion and the origination of muscles, they strap off with connective tissue on the bone, hardens because it cannot hang on to that much strain and stress.
Right.
So it creates basically a hardening of the tissue, an arthritic, just responding to muscles not give and take and relaxed state of being.
And it does create, like you said earlier, like a fibromyalgia for horses. They are sore everywhere, especially where the soft tissue inserts into the bone, because they lack flexibility. Their muscles are hard. They lack range of motion. And there's always tension in that muscle because the muscles don't release all the way. They stay hard, short, tight. In turn, that creates tension on the joint all the time. And so these horses, even though their x-rays look good and on paper everything should be fine, they're sore. Their joints are sore. Their hocks are sore. And then we go down the injection route. And then
I know. I have pictures of me being able to slide, 20 years ago or whatever, my hand down their neck and into their shoulder, all the way into my fist or my wrist. Now, it's extremely difficult to do that on any horse. And the reason why I came to that particular awareness, because a few years ago, I just started going, man, are things changing or am I imagining this? And so I had to actually think of a specific action that I used to do regularly with horses that I'm finding challenging now. And you should, any body worker that's listening right now, one of our favorite things to do is slip our hand underneath their scapula and work with the muscles under there. And it's getting increasingly hard to do that because the bodies are just becoming harder and harder.
Yes. And one of the things we notice under saddle and our dressage riders, our reiners, and our barrel horses, even if these horses don't require a lot of collection in their work, of course, the reiners and the dressage horses, yes, they do, and a lot of self-carriage, that becomes very difficult for these horses because they experience muscle fatigue more rapidly. And they have a very, very short window of time that they can work. And this doesn't happen with and what I'm saying is this doesn't happen with all the horses, but usually it's one or two of the mental signs and one or two of the under saddle signs and one or two of the physical signs we see where they're sensitive to brushing. But many of these deficient horses have developed work intolerance. They have a window of time where they can be pretty good citizens. They work, they get to their job. And then as the ride goes on, the wheels start to come off. They start to become more bracy and less soft in their face and kind of start to move more hollow back. And as they ride, they're utilizing available magnesium, which is already in short supply, and they're already operating under a deficiency. So there's not enough magnesium in the body to facilitate that work that they're doing right then.
To handle the stress.
Symptomatic. They start to become mentally fractious. They could start to anticipate the pain. They're prone to cramping and muscle burning, the lactic acid burn. And so these horses tend to get worse the longer you ride them.
And heavy breathing, heavy breathing simply because they're trying to get oxygen to the lungs.
Yeah. And chomping on the bit, hollow back, high head. As they go, their muscles become tighter and shorter, and so collection becomes harder. They've got to pick their belly up and round and lengthen those muscles across their top line. And if they're deficient, they can't do it. Have you ever tried to touch your toes and you're just too tight? You can't reach the floor? And the backs of your legs, you just don't have the stretch. You can't do it. That's oftentimes how I explain it to my clients is they literally physically can't do what you're asking them to do. They don't have the flexibility and the range of motion in their muscles. And as the ride goes on, they become more symptomatic to the deficiency. Their muscles get harder and tighter, and they get more worried and fractious. So I tell my customers, especially when we're starting them on the Magristore, is that's not a training issue. If your horse can be really good and solid for 20 minutes, then quit at 20 minutes. There's no point in riding them and pushing them past that point, because it's not a training issue. It's what's happening under the skin. Their muscles are not able to function the way you need them to. And so that's one of the things that I say in the beginning when we're getting these horses back on track is keep it short and sweet, and don't adrenalize this horse. Just give it time. We're gonna get there. Mm-hmm. But so many of my customers have been they've been around so many mountains and tried so many things that by the time they get to us, they're like, yeah, right. Okay, well, and people are impatient as well. That, we fight that a lot too, where they want to just get to the thing with their horse and get down the road and get in the show pen and have the fun. And I say, just give me a few months. We're going to get there, but be patient. Give this horse a minute to heal.
Yeah, it's a journey. It's not, and even though we have some dollars, on the table, it's a journey, and the more, it's stressful what these horses are going through. So it's fair to help understand what can mitigate stress, and magnesium can really help mitigate a lot of the stress they go through, or pain syndromes. That's what's so exciting and simple about it. Is you're like,
about a show horse's life depletes them. The work, the hauling, being in a new place 2 or 3 times a month, leaving their ranch, name it. Everything about a show horse's life depletes their magnesium and points us in the direction of get that magnesium into their diet. They need it.
It helps with the stressful parts, because horses are willing to be with us, and we know people love their horses to the moon and back. Yes. And so, I have people that love their horse that's still acting like a nut. He doesn't want to be a nut. She doesn't want to be a nut. Yes. So it's not you. It's not the horse. There's something challenging that mammal's body.
And that's a really important piece of information that I know from my own personal experience and my customers is every one of us says, this is a good horse. This is not a bad horse. This is not an ill-minded horse. This horse has moments of greatness. Like, as good horsemen and women, we know there's a good horse in there, and we've seen it and we've had a taste of it, but we can't reproduce it every day. We can't get any kind of consistency. And that's a common thread with a deficient horse, where, and my customers' feedback on their horse, like, this is a good horse. Mm-hmm. It's in there. I know it, but I can't figure out, like, this horse doesn't want to be bad. This horse wants to be good. And they almost feel like the horse can't control themselves once they hit that place where they're pulling back, or they can't help themselves.
And another way to understand the word deficiency is very important, is there's not enough of this essential nutrient to help them manage their own body. Mm-hmm. Because a lot of times we're thinking deficiency, oh, can't you just get by? Deficiency. But understand that or not. What you need to know, if there's not enough level of that important nutrient for the animal to get by, you're going to start to see some breakdown from that body burden. And the chemicals. The chemicals are a huge factor. Look, if you can't not fly spray your horse 3 days in a row with a serious heavy duty carcinogenic pesticide, if you can't not increase those magnesium levels to help the detoxing process,
because helps to eliminate and helps the body purge heavy metals in the brain. It's involved in over 300 enzymatic processes.
Exactly. Yeah.
Magnesium is required by the body to produce ATP. That's the primary energy mechanism in a muscle.
Electron transfer process,
magnesium to produce that ATP, the body taps the adrenals. And then the adrenaline burns through magnesium at a much more rapid rate. And it becomes a downward spiral. Unless and until you get magnesium levels up, everything else you do is going to fall short or be substandard.
Because we are detoxing machines. We're detoxing machines every day, all day long. Our bodies are detoxing. And if you don't have the right nutrient mineral to help you detox, you won't. And if you don't detox, you're in trouble.
Yeah.
You get in trouble.
That's exactly right. We see so many behaviors and secondary illnesses, all that circle back around to having low magnesium levels.
Or not being able to detox.
Well,
gosh,
you just become downright aggressive and violent. I had one customer who rescued. This is a typical scenario where they get passed down, one owner to the next, to the next, to the next. And usually it's a greatly bred horse. And these customers, whoever buys it the first time goes, oh, forget it. Like, let's take the tax write-off. And then someone else buys it and thinks, oh, well, my program will fix it. And they put the mash on that horse, and they really, go at it hard and try to figure out what's wrong with it and get it trained. And then they don't have success. Deficiency gets worse. That horse ends up out in the pasture or at a rescue or at an auction. So this lady picked this horse up, beautiful warm blood mare, brought her home. Everything was great. Like, I can't believe this horse, ended up in this predicament, but never mind. She's got it. Mm-hmm. So spring grass comes in. They are on the East Coast where they've got a high calcium content in their soil and their water. Spring grass comes in, high calcium, offsets magnesium. So this horse went from perfectly lovely, normal, to an aggressive, dangerous mare, and picked this lady up by her shoulder and shook her like a stallion would. Oh, she was downright evil and dangerous. And so she called me, and we kind of put our heads together. She was sensitive to being brushed. She was working on deficiency, and she was having other symptoms that, unless you know what magnesium deficiency looks like, you don't put the pieces of the puzzle together. So we put that mare on a pretty good dose. I think we had her on 10 to 12 grams of magnesium a day. And within 3 days, that mare turned a corner and went back to being a sweet horse. Now, mind you, it wouldn't probably have happened that quickly if she was also in full-time work. But it's been my experience that the lower a horse's magnesium status is when we start them, the faster they respond and the faster they turn the corner. Mm-hmm. Now, that's not to say they're completely recovered, but that's been an interesting piece of information, because you'd think it would be the opposite. The lower they are, the harder it would be to get them back. But they respond to the relief of their symptoms pretty rapidly when they're that low. So this lady knows, like, every spring and summer, that mare has to have magnesium in her diet. Other the rest of the time of the year, she's fine. So it's definitely not a one-size-fits-all either. And the industry has really trained equestrians and people like, well, one scoop, one scoop for your pony and one scoop for your eventer. And that's one of the things that we do different at Performance Equine is we don't offer it across the board in feed stores, because number one, if you don't know about magnesium and the different types of it, you're going to pick the cheaper kind. That's just human nature. And most of our clients are people who use their horses every day. Those are the horses that need more magnesium in their diet. So we often find that we have to do a lot of consults, and we offer that as a free service, in that we will walk you through the process of restoring your horse's magnesium levels. And so once you start your horse on our products, you have us to consult with. Like I said, we've got thousands of horses under our belt, and we know what it looks like, and we know how it progresses, and we know the things that can throw off your progression. And so we are here to walk you through the entire process.
That's lovely. Boy, I know you and I could go on for several more hours. Yeah, I'm gonna ask you a couple questions here. I know this we'll have another chat someday. Carla, what would you like to see? And I know you owned a Rainer Jersey, a horse we worked on together. That was what a beautiful horse that she was. Yeah. And I won't get into too much detail on her. We'll do that for another conversation. But what would you like to see happen for the horses now and in the future, especially the ones that are used for vehicle and entertainment?
I would just like to increase the knowledge base. I think so many of the behaviors that come from magnesium deficiency get passed off as, oh, this horse is just thin-skinned, or he's just got too big of an engine, or this horse just can't relax, or this horse is ill-minded. I think a large percent, probably 70 to 80% of those horses are deficient, and people just don't know. I think this message needs to get out there to the masses, especially people who use their horses as show horses and work horses. Mm-hmm. I think that veterinarians need to be made aware of the symptoms and the group of symptoms. It's like we said, it's usually a perfect storm, and it's not just one thing, and it's not just one symptom. I think that so many vets just are completely unaware that this is what it looks like on a horse. And I think that they see a lot of these horses and, they don't really have a lot of tools for them.
Again, if you're a veterinarian that's interested in functionality of the body, study with the human medical functional wellness doctors are doing. There's many of them out there. Dr. Erica Seed, Joel Furman, Mercola. There are a lot of them, and it's not that you need to go completely that way, but we have veterinarians that are in absolute control over these animals' bodies, and it's fair to the animal. If you offer your gold standard of care, your Western medicine knowledge, but if you are maintaining the control, basically when a person brings you their horse, they say, "What should I have, doc?" If you're treating that athlete, then maybe need to look into the human functional wellness worlds and what are those doctors doing for those patients that have pain syndromes, central nervous system issues, chiropractic muscle issues, chronic fatigue, fibromyalgia, sleeping disorders, functionality disorders. What's going on? And we'll find that magnesium is really nobody can argue about the power of magnesium because the body's starving for it.
That I'd like to address too, this is a real common question, two things: toxicity and testing. So one of the most common questions every day, every customer asks us, well, can I do a blood test? Or I did a blood test and my magnesium levels came back normal. And so this is a common misnomer in medicine, in that vets will often say magnesium deficiency is extremely rare because every time we test for it, it comes back normal. However, serum blood isn't an accurate way to assess a horse's true magnesium status because only about 1% to 2% is even stored in the blood. The rest of the body's magnesium is stored in soft tissue and bone and muscle. So if that horse has a deficiency, the body is extremely efficient at maintaining that 1% in the blood because it facilitates the heart and the organs. So we can have a horse that's very deficient and still come back within normal ranges on their serum blood. Mm-hmm. Number one. Number two, toxicity is rare because it's very difficult to get a horse to eat enough magnesium to create a toxicity because they will get diarrhea and loose manure before that ever happens because the body naturally excretes unabsorbed or unused magnesium, makes it out to the colon, pulls in water. We said magnesium is hygroscopic, pulls water in. So that's why magnesium has a tendency to loosen a horse up, and people, anything. Mm-hmm. But it's often dependent on the quality of magnesium you use. So oxide and citrate and sulfate, very prone to making a horse loose. And if it's coming out the back end, that means it didn't get absorbed and it's not therapeutic. So it's really important to use a high quality magnesium, and citrate and oxide are just not great sources. And that's why, we've chosen to use the dimagnesium malate. It's very, very bioavailable. Horses do really well on it. And very rarely do we see loose manure. It does happen, but not very often.
Mm-hmm. Wow. So we have some public questions, 2 public questions, then we'll wrap this up. Okay. And one of them is, does your product help the joints? Does magnesium help the joints?
Yes, indirectly. Not like glucosamine or hyaluronic acid, not within the joint, but because the soft tissue is always tight and hard and lacks flexibility on a deficient horse. Like we said, there's always tension on the joint and they become sore where the soft tissue inserts into the bone. So when we relax the muscles and when we help a horse with anxiety, thousands of things open up and get better on that horse's body. When we help them with that tension and the muscles can relax all the way, then the joints feel better.
Mm-hmm. Yes, because a closed joint is a closed joint. Can't have a lot of fluid in the joint if it's closed.
Right.
Okay, I could go on for quite a while on that question, but we'll wrap that up with it. Next public question. Does your product help prevent leg cramps in horses? I think we addressed that, but we'll go ahead and specifically touch on that again.
cramping is very much a symptom of magnesium shortfall. So when we get a horse's magnesium levels back up where they belong, all of that goes away. The cramping is a definite symptom of magnesium shortfall.
Mm-hmm. And some things you might notice is some quivering, shaking, inability to stand for the farrier. A lot of times the horse can't say, oh, you've been standing next to somebody and they're like, oh, I have a cramp. I have a leg cramp. Well, you didn't actually notice they had a leg cramp until they mentioned they had a leg cramp. So the horse can't say, hey, I've got a leg cramp. We have to look for signs in their body that they're struggling on that limb. And
oftentimes we see wandering lameness in these magnesium deficient horses. So remember we talked about when you get a cramp, how it kind of hurts for a few days after. And so a horse will sometimes be a little bit like, that I don't have enough swing in that leg, or that leg isn't quite under the horse. So you feel it where that horse just doesn't trust that leg.
Little head bobby, off and on.
Come out and they go, well, everything looks fine. And then the next week it's the opposite diagonal front leg. And we see these horses have kind of a wandering lameness, and it's because they get a cramp, they get sore, they guard it. Then they overuse another muscle group, they get a cramp, they get sore, they guard it. And these horses, again, vet bills up the wazoo. You're always calling the vet for something because it's always something. They really do drain a horse owner's wallet and just drains the fun out of the sport because you just can't figure out what's going on with your horse.
Exactly. And yes, that's why this is an all-encompassing, all-loving.
Horses like there are children, and I've had so many clients when we get a resolution and we get that horse feeling better, like they cry on the phone with me. They're like, oh my God, you saved my horse. Like this horse was going to the auction or the vet told me to put this horse down. This was my last ditch effort. So many of my horses come to us in that state where they don't have many options left.
Mm-hmm. Well, the good news is that the public will stop at nothing to help them. So that's why you and I are relevant, and people like us will always be. And that makes me feel really good about our conversation, our all-loving, all-encompassing conversation. Yeah. And so, Carla, where can we find you on the internet?
Thank you for asking. We are Performance Equine Nutrition, PEN for short, and we are at performanceequinenutrition.com. We have a magnesium deficiency questionnaire on the website that people can take, kind of help them guide them in the direction if their horse is operating under a deficiency. And the best way, if you're really struggling, call me. I love spending time with my clients on the phone, and sometimes a 5 or 10 minute conversation just gets us on the right path right away. People sometimes don't realize that the things in their diet might be contributing to a deficiency, or this horse has been on omeprazole for 6 months, or this horse gets slippery elm in their diet, which can inhibit absorption. So sometimes these conversations that happen organically, just talking about their horses, give me valuable clues to give better guidance and help with dosing and things like that.
Mm-hmm. I can't thank you enough for joining us this morning and speaking on behalf of our beloved, beautiful horses.
Yes. And this has been wonderful and great, and it makes me feel so good to be able to get the message out to more people who are struggling with their horses. That's the bottom line. People need help with these horses, and these horses need help. And it's not that big a deal. This is an easy thing to give your horse. It's easy, and it makes a difference in so many areas. Performance, how they cope with stress, and it can change a horse's life. Literally, I've seen it happen thousands of times.
Yeah. And it's never one thing, but this is a very big and exciting thing. So I want to thank you, Carla, and for the horse loving public out there. Keep loving those horses. And Carla, we'll talk again.
Keep searching. And I want to tell you too, if one of your customers or someone calls me and they try the magnesium, just, hey, let's give it a shot. It's not going to hurt. And it doesn't work, you get your money back. The most important thing for me is to encourage you to try it that's probably what your horse needs.
Well, I hear rave reviews. I do not push people to, like I said in the beginning of our conversation, I'm very careful to push the public on things that I find. I do what I do really well. I learn a lot from the public. However, when I do mention Mag Restore, and I've actually mentioned it quite often because it is critical, and almost every person on their own comes back to me and says, wow, I really recognized a difference.
Yes. Yeah.
So
I love that. And that's so rewarding because that's why we're here, right? To help these horses have a better life. And if they behave better and they work better, they have a better life. They have a good home. They have owners who feel like they're connected to their horse and they're having fun.
Yeah, because we really love these ponies.
Yeah.
We all love them so much. Yeah, they give us a beautiful life, and so in return we can give them our heart and soul by learning from people like you. So again,
thank you.
Yeah, thank you too. And I know we'll speak again. And until then, peace out.
All right, miss.
Bye-bye.
Bye-bye.
All right, horse lovers. Thank you for listening to this episode of Confessions of an Equine Body Worker. If you enjoyed it, be sure to like and subscribe and keep an eye out for more interviews, horse tales from the heart, and educational episodes. Until then, keep loving them horses.